In the last session, Dr. John Hayes talked about what happens during the AFib rhythm. In this session, we'll be talking about what causes atrial fibrillation, triggers for episodes, what risks to be aware of, and issues relating to self-monitoring of atrial fibrillation. In terms of what causes atrial fibrillation, we should perhaps consider it as a broader topic under headings of foundational factors, trigger elements, and what I would call volatility factors. Now, there are a number of elements that can lead a person to become vulnerable to atrial fibrillation. And those things would include becoming older, having high blood pressure, a number of things that would cause stretch of the little chambers of the heart, leaky valves, hole in heart for instance, weakness of the heart. There are genetic drivers of atrial fib. We will see patients who, in their family, a number of people have been affected, particularly at young age. And then there are also elements relating to being overweight, sleep apnea, and so forth. So we think of those as the foundations for atrial fibrillation. These will cause changes in the electrical behaviour of the atrial wall, a bit like a road with potholes, so that instead of cars being able to drive smoothly down the tarmac, they might have to meander around potholes. That with the changes in the wall, we have electrical conduction affected, that it is no longer smooth, and we can have the potential for eddies and loops and so forth to set up. Now we have triggering elements that are a bit like a gas barbecue ignition. So if we have the image of gas being ignited by the piezo circuit in the heart, you have triggering from pulmonary vein muscle, where a short burst of electrical beats can trigger the episode. This important finding, made more than 25 years ago in Bordeaux, remains the cornerstone of atrial fibrillation ablation management. What's often very relevant for patients is the concept of what I would call volatility, the things that might make a person go into atrial fibrillation at this point in time. So they would be things like infections, surgery, major stress, and consumption of caffeine and alcohol. There are also unique triggers that in certain individuals it may be that they have their episodes mainly after a big meal where there's stretch of the stomach, during sleep, and after exercise. The common denominator here is probably vagus nerve stimulation of the heart. So the vagus nerve is part of the parasympathetic nervous system, and stimulation of that nerve under those circumstances post-meal, post-exercise, and in sleep can be an important trigger for some people. Even things like cold drinks where there's direct cooling of the back wall of the heart from the esophageal wall. So in an individual, there may be unique triggers for them, but across the broader spectrum of atrial fibrillation patients, there may be many different factors. So it will often be in an individual that elimination of triggers alone is only part of the picture, that we have to deal with a more comprehensive strategy addressing the foundational factors as well as the triggering elements. And so that will incorporate control of blood pressure, weight reduction, and dealing with things like sleep apnea, for instance. When it comes to atrial fibrillation and stroke, we have the contribution of irregular contraction of the heart wall, quivering if you like, that means that the blood is not being squeezed out of the way as it should be, so blood can stagnate and clot, and then the clot can flick off and head to the circulation in the brain, leading to a stroke event. There seem to be a number of factors that, in addition to atrial fibrillation, drive the risk of stroke. In that space, we're mainly considering advancing age, high blood pressure, diabetes, weakness of the heart's contraction, and previous stroke. And in patients who have these co-risk factors, we would often make a recommendation for use of anticoagulant medication. In the old days that was warfarin, but we have newer agents now that don't require blood testing, nor do they have any major dietary or drug interactions. For some patients though, There will be devices that are used to plug the appendix of the left atrium to reduce the chance that clot could arise and flick off and go to the brain. In terms of monitoring of AFib episodes, we now have an array of technology available to us. The latest watches have algorithms for identifying atrial fibrillation based on heart rate, irregularity and so forth, and the latest devices will also enable recording of an ECG. This can be quite helpful in the early phases of confirmation of the presence of atrial fibrillation or whether it's another rhythm disturbance. Over time, it can be helpful in recognising whether we're dealing with ongoing breakthrough atrial fibrillation in spite of treatment, or whether we're dealing with slightly different rhythm abnormalities that might be of less concern. So in some cases it can be helpful to use the technology to confirm that the rhythm is stable. On the other hand though, one mustn't put too much emphasis on the monitoring that it's actually driving concern. There can sometimes be relatively minor rhythm changes that will lead the devices to flag a high heart rate or an irregularity of rhythm that really isn't of any great concern. But we'll discuss those elements in detail during the consultation process. In the next session, Dr. Kin Chi will be talking about medications and the role that they play in managing our patients with atrial fibrillation.